Okay. Hi, I'm Kate Grace. I'm a physiotherapist and orthopedic physician assistant here in San Diego, California. I spend part of my time at our rehab facility here, and part of my time in surgery, and part of our time doing international medical education seminars. Myself and our team of people here have been asked to create non-operative, preoperative, and postoperative programs to help assist you with your patients, especially patients who don't go to surgery that need your help. What we'll share with you is our knowledge and treatment methods. We'll show you how to perform orthopedic tests so you have confidence that what you find on your test is really what the orthopedic problem is. We'll teach you how to use those orthopedic test results to formulate your diagnosis. Once you've formulated that, then you'll be able to educate your patients about their diagnosis, explain it to them, explain your treatment plan to them, so they have confidence that you're going to help them resolve whatever challenge that they have. We'll show you how to create effective treatment plans for immediate patient results and design long-term treatment plans to overcome any challenge they have and introduce them to a whole other level of health. Several tests you can do to differentiate between different pathologies. For example, you can bring them up in horizontal adduction to test if they have an impingement. Another common impingement test is Steadman-Hawkins, dropping the arm down. The patient complains of any pain here in the impingement area, that would be positive. You can do a drop arm test where you ask the patient to keep their arm out at the side, hold it there. If they're unable to hold it there and it drops down, most likely a rotator cuff tendon tear. They can do a SPEEDS test, which is a test for biceps tendonitis, holding the arm out like that, pushing down, they get pain in the area of the biceps tendon. You can also do an O'Brien's test to check for the labrum or the AC joint. In the spine, there's many positions you want to check for vertebral mobility. For example, flexion in standing, where the patient goes down into full flexion, comes back up as you watch the vertebrae move segmentally. Extension, same thing. Side bending, same thing, watching their spine move in sequence. And then there's one other test that's very important, particular to the lumbar spine, and that's called a side glide, where the patient keeps their shoulders in alignment and they shift their hips without bending their knees off to one side, back to the center, and then back over to the side and back to the center. It should be equal and symmetrical on both sides. The other test you might want to check for SI joint is put your fingers on the posterior superior iliac spines, have the patient bend one knee up toward them, and the PSIS should drop down distally, and the opposite side. And again, it should be symmetrical and even. Many manual therapy techniques you can use to gain cervical range of motion or mobility. One is called mobilization with movement, where you would identify the joint that is hypomobile, place your hands on the joint and have the patient extend their head looking back up to the ceiling as far as you can go pain-free, and then come back and do that again. And you would do that 5 or 6 times with the patient until they could do cervical extension pain-free. The next thing you might want to do is to gain cervical rotation, is rotate the patient until they can't go any further. Put your hand on the spinous process of the hypomobile joint, have the patient hold their head right there so they don't move any further, and then as they relax, you'd rotate their head further. At the same time, you're simultaneously mobilizing the spinous process of the hypomobile joint, bringing their head back to neutral again. The spine is meant to move in many different directions. One of the most common hypomobilities of the spine is lacking extension. This is common with people who avoid extension. Maybe they have herniated discs. So to gain more extension in the spine, you want to teach them press up. To do it properly, the patient's hands are placed next to their ears. They're going to start with their cervical spine first, bring their head back, and then as their head comes back, they're going to straighten their arms up and think about one vertebrae at a time, thoracic spine, lumbar spine, coming up to the top, sagging, making sure that nothing on the back side is tight. And then as they go down, very important that they start with the belly, then the next thing to hit are the ribs, and then the chest and the head, so it gets in the opposite motion as coming up. One more time, head back, one at a time, the vertebrae comes up. What you want to watch as a therapist as each segment should be operating with the same amount of mobility. If it's not, you then can mobilize the hypomobile spine, mobile vertebrae, and then have them repeat the process. It's very important for you to look at your patient's posture alignment. particularly to identify current challenges and any predisposing factors that are setting them up for orthopedic problems. Simple way to do it is set up a grid in a wall or a door in your clinic and just a piece of rope that we call a plumb line. What you want to look for is sagittal planes, frontal and transverse planes. And our patient here is standing looking forward where the rope is splitting her in half, so you can easily look at right and left halves to pick up asymmetries. And then if she turns and faces the side, you can line the plumb line up right at her lateral malleolus, and you can check her frontal. This is our therapy dog pork chop. You should all have one in your clinic. I hope this has given you just a little bit of taste of the things we'd like to share with you to create non-operative, preoperative, and post-operative programs for your patients, things maybe you aren't doing currently, and give you great ideas to help them more and avoid surgery, and give you many more tools in your toolbox to help your patients and create more healthier lifestyles and allow them to perform all the activities that they really, really want to do in their lives.